So Kaiser was formed in Oakland, and so here we have our flagship hospital, which is brand new. We have 349 beds, and we are like the center of excellence for a lot of specialties like our solid and liquid tumors, spine surgery, cystic fibrosis, referral center for thoracic surgery.
All our rooms are single patient rooms, and they come with such a great view.
What I love about Kaiser, if I were a patient, is the fact that it's an integrated health system. So basically my outpatient doctor notes are in the EMR, and if I'm ever hospitalized, my inpatient doctors can take a look at all the notes and what led me to this hospitalization, all my prior meds, prior surgeries, and I think it's a nice one-stop shop.
So my favorite inpatient rotation is infectious disease, which is what I want to go into one day. On that team, you get to work with multiple different attendings as you go through the weeks, as well as a multidisciplinary team with our inpatient ID pharmacist, Marcy Glick, who's amazing and knows everything about antibiotics.
Favorite rotation is the ICU. Just really like working in a room right across from our patients. Learn so much from the interns, residents, the team, the nurses, respiratory team. Like, you just learn from everybody. Everybody's so experienced.
I'm currently on my cardiology rotation, which has been awesome. I've been able to see a couple of casts, a couple of pacemakers put in. We get all sorts of really interesting pathology that came in. We've had a couple of tamponods, bunch of STEMIs. So we see a ton here, and I'm having a great time. I'm actually in front of the telling machine right now.
My favorite place to get food is honestly in the resident lounge. We have really amazing bakers in our residency program who bring in baked goods all the time.
One of the best parts of the residency is getting catered lunches every weekday.
Our favorite place to get lunch is the cafeteria.
Like, we have this great locker space, and my favorite locker that always has the best snacks is Donna's locker.
This is my favorite place to work so that I can work all day in the hospital but also get some vitamin D.
Hi, so I'm working at the consultant station in ED. So this is our ED station where we work with ED physicians side by side. We have 52 treatment bays, private rooms, and this is where we admit patients and have our own stations to work on.
The call rooms are a great place to work because they're quiet. We actually have 2 dedicated call rooms for the residents of our program.
The library is a great place to work too. Look at all the computers and the space you can do here.
I have an excellent palliative care team with a number of really great chaplains that can help talk to your patients at any time. Michael Lemaire is the best.
I grab my handheld ultrasound to answer point of care questions. Every wards team has an ultrasound, and even if you're not on a ward team, you can go grab ultrasound just in the chief's office.
As Kaiser residents, we get free iPhones, and as part of that, we get an app called Cortex that allows us to text anyone, including our attendings, and even Dr. B.
Our lovely atrium is one of my favorite places to get away from the hustle and bustle of the hospital. If you just want to grab a coffee break or eat some lunch outside, almost feels like God work.
When I really need to pick me up and I'm just feeling really low, Dr. Sarafi is one of the first people I go to. There you go.
We have our lovely chief's office. Their doors are always open to chat with us and get anything that we need.
With goodies!
Whenever I need a pickup, I go to HBS to see Dr. G, who had interviewed me and has left a lasting impression on me since. His use of levity and humor on rounds really puts me in the best mood when I'm having a rough day, and I appreciate all that you've done for me to get acclimated during the year. Okay, where's my $100?